Chief Medical Correspondent Dr. Jon LaPook is in Washington. John, good morning.
Good morning, Charlie.
Why is Frieden so insistent that this had to be a break in protocol?
Well, you heard Manuel say that it's very easy to get infected. Even though you think you're following protocol, when you're taking off the gear, it's possible to expose your skin. And this happens especially if you're not specifically trained in how to do this. And of course, that hospital did not do specific training beforehand. This was a surprise to them. And I think supporting the fact that the protocol probably does work if followed correctly is the fact that there were two places, Emory and Nebraska, where five people who were infected were treated, and none of the healthcare workers there became infected. They do drill all the time there.
So is there any other explanation other than that?
I don't think you have to invoke that right now, Charlie. There's 4 decades of experience with this virus, and it is known how it is spread.
So given that, and there is an inquiry underway, and President Obama has said that this inquiry should happen as quickly as possible, should Ebola patients only be sent to these specialized hospitals?
Nora, I think that is a very reasonable and good suggestion. I actually emailed Tom Frieden, Dr. Frieden, the head of the CDC, yesterday morning and asked him that. And I did get an answer back later in the morning saying that the CDC is going to consider that. So I think that is very reasonable.
Let's talk about the reliability of fever as a symptom, because the New England Journal of Medicine had a study that found 13% of patients with Ebola in Africa had no fever. Based on these findings, what should we know?
Well, a couple of things. First of all, in that New England Journal article, they defined fever as anything greater than 100.5 or 100.4. But if you look at that chart, there's a little asterisk, and it says that the healthcare workers, next to the 87%, the healthcare workers who were taking the fever, they often didn't have temperature in the districts in West Africa. So they would just say to people, do you have fever? So it could be underestimated, and also fevers can come and go. But I think it's a very good point that you can't just rely on fever. There are other symptoms, of course. We know vomiting, diarrhea, fever, headache. And so you have to think about that as an entire constellation. And in fact, I asked the CDC about this. They said, yes, they really should have been saying fever or other symptoms.
Fever or other symptoms. John, thank you so much.